Okay, so we're all born with a certain number of fat cells, and throughout our lifetime, these fat cells go up, down, up, down, up, down, depending on lifestyle, genetics, hormonal, environmental factors. And in terms of fat cells, we have superficial and mid-fat, which is grabbable like a burger, you can actually grab it. And then you've got end organ fat that you don't actually see, so that's lining your vessels and your heart, like cholesterol and things like that. So fundamentally, when we're looking at fat and we're assessing your body to give you the perfect silhouette that you prefer, we have to look at which modalities can treat which fat cells correctly. And the areas in terms of fat distribution we're looking at is submental. In the front, for women, we have bra puffs. For men, we can have gynecomastia or man boobs. Then we've got upper, mid, and lower abdominal fat. Then we have, there's a trend at the moment for the thigh gap, so we might have a little bit of thigh chubbiness. Then we've also got outer thigh. Then we've got superficial knee fat as well. And if we turn you around on the back, we're looking at upper back, mid back, lower back, which is commonly known as flanks. And underneath the gluteal area, we're looking at banana rolls. So these are the areas in terms of fat or fat distribution or fat assessment that we look at. If I can grab it like a grabbable burger, like this when you eat a burger, that means superficial and mid-fat, and that's treatable. And we can use things such as lipolytics, injection lipolysis to break down the fat cells, or we can use laser lipolysis, so we can laser and zap it away whilst you're plugged in and watching a movie, and that grabbable stubborn area of fat that you can't get rid of despite starving, intermittent fasting, or doing everything else, we can just plug it in and we can give you the perfect silhouette so you won't have lumps and bumps. However, if it's just a tiny amount of fat and you can't grab it like a burger, I prefer to leave it, because fundamentally, if I remove fat, what happens? What does fat lie underneath? It lies underneath skin. So if we remove that fat, the skin deflates and you end up getting skin laxity. So you have to be careful in your assessment and in your intervention. Then what we can do in terms of end organ fat, we can hack your metabolism to optimize you. So we can use exogenous and endogenous things, hormones and things like that, to get you back into fat burning and make sure that you're not lining fat. But we have to medically assess you to see if this intervention is appropriate for you. So fundamentally, there's lots of things we can do in terms of giving you the perfect silhouette to suit your ethnicity and heritage, but at the end of the day, the assessment has to be correct.